right, welcome everyone. My name is Megan. I am the manager at St. Jude Wellness Center, and I am here with Gianna Durocher from St. Jude, and we're just going to have a conversation about cancer survivorship. So, welcome, Gianna. Can you tell us a little bit about your position?
Absolutely. So I've been the survivorship coordinator or survivorship navigator for about 2 years now, and it's a really exciting role, and I'm just very excited to be in it in general. Basically, my role is to make sure that we have the processes and the services and the programs in place to support our patients that have gone through cancer treatment. And so sometimes that looks like what we can do to help fill in gaps during the cancer journey when patients are actually going through treatment, but also very specifically for when they're done, because that can be a very distinct phase of the cancer journey. And we want to make sure that we can support those patients that are coming out of their treatment and really help them with their health promotion and recovery as they basically go back to life.
Love that. And can you define cancer survivorship for us? Because I think there's a lot of question marks on, does that mean I'm in remission? Does that mean I'm so many years out of remission? What does that mean?
Sure. So there's a couple of layers to that question. But we here at St. Jude believe that anybody that is diagnosed at the moment of their diagnosis is considered a cancer survivor, right? They are living and getting through their cancer treatment. So again, everyone is a cancer survivor at the moment of diagnosis. However, the nuances of that question can be a little difficult to answer, but we say over time, the more time that has gone by for patients after they complete their treatment and cancer hasn't come back, the more that we've solidified that we've cured them of their cancer. So yes, you hear the word remission, you hear the word cure. Without getting into too much nitty gritty, they more or less mean the same thing. But again, over time, as people get farther and farther out from their treatment, when a cancer hasn't come back, then that tells us that we've done our job.
Got it. Thank you for clearing that up. And just before we get into questions, to kind of circle back to your position, it is a fairly new position for St. Jude. So what are kind of the goals? What are you hoping to achieve here with this kind of direct service line?
Sure. One of the things I don't want to forget, and it's always at the forefront of my mind, is to really listen to our patients and our cancer survivors to hear what their experiences are and figure out if we're missing the mark somewhere. I always want to hear from people and hear, what is it that was their biggest challenge, or what barriers did they encounter as they go through their cancer treatment and into survivorship, so that we can make sure that we have the services and programs in place that really support people the most. As with any organizations, resources can be a little limited, but again, we can get really creative in how we intervene for patients, and we want to make sure that we're doing that.
Yeah, great. And that's where you and I have really come together for the cancer wellness program. Is there was a gap and a need in providing fitness and education programs to people coming out of treatment, and the program was born. So that's kind of where today's questions have stimulated. Is we initially asked our cancer wellness program participants if they had any questions, but then we opened it up to our broader wellness community to see if anyone has questions about survivorship. So we had a few trickle in. We've been a little bit selective so that we're not all sitting here for 2 hours listening to fascinating information.
Sure.
But we'll kind of go through these questions right now.
Sounds good.
So the first one is, what pharmaceutical therapies do you recommend to reduce inflammation and prevent recurrences?
That's a great question. And inflammation, as we've learned over the years, is definitely tied to an increased risk of cancer. So whether it's for a cancer survivor, a current cancer patient, or just somebody out in the community, it's important to make sure that we are doing what we can to reduce inflammation in our bodies. And generally speaking, I actually wouldn't recommend any pharmaceutical therapies to reduce inflammation or prevent occurrences. This can actually be done best through just general lifestyle changes. And there's plenty of evidence out there that supports this viewpoint. Like the National Institutes of Health, the National Cancer Institute, the American Cancer Society, they all recommend that we make lifestyle changes to prevent cancer occurrences. And so that means that we're focusing on 4 different things: diet or nutrition, exercise or physical activity, depending on which word you'd like to use, and then sleep and stress management. And I admit, right, Megan, you're a dietitian. So when it comes to nutrition, I really rely on your expertise in talking about, utilizing food to minimize inflammation and cancer prevention. Although I'll say one thing right here, and then if you would like to share your viewpoint on this, many medical associations and national cancer organizations as well recommend that we minimize or even eliminate our consumption of alcohol because, right, as you know, alcohol can definitely add to that inflammation and put people at higher risk for cancer. Would you like to share more on nutrition?
So, and I do recommend people join our webinars for kind of deeper dives into this topic because it's a huge one as far as food for inflammation. But the main areas that I usually focus on are plants because plants give us a twofold benefit for reducing inflammation. One is their phytonutrients, so they help our immune system, and two is the fiber, so they help our detoxification system. The other is protein, making sure that we are creating a really good space for muscle mass, which helps our metabolism function, and then just reducing added sugar and reducing alcohol. Those are kind of where I'm always looking at is big ticket takeaways.
Yeah, no, and those are really important and great points. So I'll move on to the other three pillars that we talk about for a healthy lifestyle. So physical activity, and I'm very specific about using that term physical activity as opposed to exercise, because a lot of people, when they hear the word exercise, they just ears turn off. And physical activity can mean a number of different things. So let's use that word. And obviously physical activity is very important for our bodies and our minds. But overall, being overweight and obese really pushes our bodies into an inflammatory state, which then also increases our risk for cancer. So really weight management is part of this conversation. And for those cancer survivors whose cancers actually feed off of estrogen, it's important to know that actually fat cells can produce estrogen in the body. So then when there's more fatty tissue, there's a possible risk of having more estrogen in our body in that way. And in that sense, also increasing a cancer risk. There's been many clinical studies that have shown that physical activity can actually be protective against certain cancers. And those main ones being breast cancer, endometrial cancer, prostate cancer, and colon cancers. And they recommendations include a certain amount of minutes per week to really kind of hit that goal to prevent that inflammation and to reduce our risk for cancer. So generally speaking, we're looking at 150 to 300 minutes of moderate intensity physical activity per week. And this can be something as simple as walking, house cleaning, even just some light bicycling. All of those work, but if there's something specific that someone's passionate about, I always say go with what works for you, something that you know you would do and that interests you. But basically, we're looking at getting our heart rate elevated, even if it's just a little bit. Or if you're up to the challenge, you could do 75 to 150 minutes of vigorous intensity physical activity per week. And this could be anything like hiking or jogging or really getting into the bicycling, anything that even elevates our heart rate even higher. So that's the part about physical activity we need to keep in mind. When it comes to sleep, I actually worry that we don't talk about sleep enough when it comes to our health. Getting adequate sleep really allows our bodies to rest and recharge. And when we don't get enough sleep, that's actually associated with increased weight gain and metabolic syndromes like high blood pressure or high blood sugar, even abnormal cholesterol. So getting a good night's sleep is actually really important, and we should all be aiming to get 7 to 8 hours of sleep per night. And then stress management, well, stress is unfortunately just a normal part of life. I think we've all experienced stress from time to time. And there's good stress and there's bad stress. And when it's just something really short and comes and goes, that's not such a bad situation. It's that chronic stress, however, that can really increase our risk for many diseases, including cancer. And some of that is because it's fueling that inflammation process. So, when we're stressed, we oftentimes sleep less, we're less active, we tend to consume more alcohol or tobacco, and none of those are good for our overall health. So we really need to find techniques that work for us as individuals to help us manage our stress. For some people, that looks like exercising. Maybe it's yoga, meditation, even prayer, listening to music, dancing, reading a book, journaling, right? The list goes on and on. But it's really, again, finding that activity that calms you down, that brings you peace or joy, and used consistently, and especially when we are stressed, that really is going to help us. And luckily, we live in a very technologically driven world that there are so many apps out there now that we can tap into that help us use these techniques. Again, whether it's a yoga app or a breathing app or a prayer app, they're all great resources and help us really get into that stress management piece. And then last but not least, on top of these pieces, we want to make sure that we're not using tobacco if we can. There's definitely resources out there to help people quit, and that's smoking or vaping. Following our cancer screening guidelines, which means right every year or when it's recommended for us to go get our mammogram or our prostate exam, we're following through with those things. And then wearing sunscreen. We live in Southern California and have many, many sunny days, so it's making sure that we wear our sunscreen or hats or really avoid the hot sun between 10 and 4, especially during the summer times.
Yeah, great. And I love how often I heard you use the word consistent when you were talking about sleep and stress management and physical activity, because I think that's also a key that people don't often think of, well, as long as I'm getting I go to the gym twice a week, and usually I'm fairly, I sleep fairly well, but that consistency is really important, especially for the stress management, because I think it's common too, where I talk to people who say, oh, I handle my stress really well. And we don't feel stressed and overwhelmed necessarily because we're someone who's able to put it to the side, but that doesn't mean we shouldn't be practicing those techniques on a regular basis. So yeah, thank you for that.
No problem.
All right. Next question is, what is your take on using ivermectin to treat or prevent recurrence?
Okay, yeah, I've gotten that question before. And I would say you can always ask your doctor about any medication that you're curious about when it comes to their benefits for you in your cancer journey. Your doctors try really hard to stay up to date on the latest findings within the medical community, which, by the way, can be very hard to keep up with. There's constant results coming out from clinical trials that are done, not just here in the US, but across the globe. And so there's constant change when it comes to being in healthcare. Overall, though, specifically to ivermectin, there has not been good evidence that it has a role with treating or preventing cancer.
Okay, good to know. Next question. What recommendations for holistic post-cancer treatment to support and expedite recovery? And I think a lot of this is related to the inflammation question, but anything else that you could add to that?
Yeah, and it definitely relates back to what we've already talked about. But I'd also like to throw out there and recommend our cancer rehab program as well as our cancer wellness program. These are a great way to jumpstart that recovery journey. Our cancer rehab program is for more intensive work that needs to be done. People that need cancer rehab are usually more debilitated after their cancer treatment, so they need a little more support. So cancer rehab includes our physical therapists, our occupational therapists, as well as our speech therapists to really provide those interventions and recommendations and ongoing support to get people recovered. I'd say, generally speaking, though, most of our people are a good fit for our cancer wellness program to jumpstart the recovery post-treatment. And if you're not familiar with our cancer wellness program, it's a wonderful program. It's several months in length, and we really try to provide all the education and tools you need to continue your recovery journey after the cancer wellness program. But we get you started with fitness twice a week and then integrative therapy workshops as well. And that's where we really educate and learn on different tools and resources that we can integrate into our own lives to continue that wellness and recovery journey. I think also talking to your doctors can be helpful, especially if you have any lingering side effects from your treatment that are bothersome, especially to your quality of life. Make sure that they know about those so that they can intervene and support you in your recovery as well. You never know, maybe a new drug just came out that would help support you. So make sure you talk to your physicians. And the other thing I really want to talk about that we kind of touched on with our stress management, but right, mental health. Readjusting back into life after treatment can be very difficult for some people. What I usually say is if it interests you, finding a support group can be a great way to help your recovery. Finding support with other people who have gone through a cancer treatment can really be very helpful and provide a very meaningful relationship where both people really can understand each other much deeper than, say, somebody that hasn't been through that cancer treatment journey. For other people, maybe it's talking to a priest, a therapist, a spiritual mentor, or even a health coach. That maybe that's what you need. So everyone has different needs and preferences when it comes to that recovery. I would just say seek out what sounds good to you, what resonates with you. And luckily, the Wellness Center, or I'll say the Center for Rehab and Wellness in general, is a great place to start. Right, the Wellness Center has so many different holistic ways of finding ways to recover and really promote your wellness.
Yeah, and just trying new things, just because your neighbor loved sound bath doesn't mean it's going to resonate with you. And I think it's important to not discount things and to keep trying to see what fits. And I loved your recommendation to continue talking to your doctor about ongoing symptoms, because I think it can also be common for people to think, well, this is just my new norm. And this is what I have to get used to. And if it feels wrong, or if it's hurting, or if it's just getting in the way of life, it should be something that you continue to bring up.
Absolutely.
So, all right, next question is there anything proven to work well specific to brain health and or patients with aphasia?
Okay. A little more specific question there. That's great. I'd say generally speaking, eating well, being physically active, good sleep, managing stress, all the things that we've talked about is a great start for our brains. If the underlying question here is about what we would call chemo brain, then my answer is still the same, but plus a few recommendations. So, right, when we talk about chemo brain, it's having that memory loss. Sometimes it shows up as difficulty word finding, or just overall forgetfulness. Where did I leave this thing? I just walked into this room. Why did I walk into this room? Right, it can be very frustrating. And it's not uncommon among patients who have gone through cancer treatment. And luckily, there are many organizations that continue to try to understand this process of why it occurs and also what can be done to prevent it or solve it. So more to come, hopefully, in the very near future. But current recommendations include maybe just seeing a therapist can be helpful. There are some medications out there that can help as well. So again, talk to your doctor. And then those general forgetfulness type of situations, sometimes writing a to-do list can be very helpful. Maybe it's writing reminders on Post-its. I know me personally, I even just keep a to-do list on my phone. People sometimes will put pads of paper next to their bed, so when they wake up and think of things, they can write it down right away. But again, the phone can be a great way to kind of keep some things in order and give you reminders. Also, completing one task at a time can also allow your brain to actually function optimally. When we multitask, our brain actually really isn't meant to multitask. So just if you're at a desk or at work or just at home trying to figure something out, just give yourself a minute and focus on one thing at a time. And you may find that your brain can actually run more efficiently. Otherwise, some people like to do what they call brain exercises by using puzzles or card games, learning a new hobby or playing an instrument. Those things kind of help work your brain muscle.
Yeah. It's interesting, this question on the timing. We're actually working on creating more of a brain wellness program that includes exergaming and dual tasking. So we're on our way there, but also creating some education on ways to pay attention. Sometimes it's not so much that our memory is not working, it's that we're not paying attention as much as we maybe should on the forefront. So, tips like making up words that go along with what you're hearing. So if you're having trouble remembering someone's name, what else starts with the G when I'm trying to remember Gianna, or a picture or an image that I can think of that visually reminds me of the word Gianna. There's some cool tasks and tips out there to help you pay attention at the get-go.
That sounds phenomenal. I'm looking forward to that.
Yeah,
Sounds like a really great program.
yeah, and just also on a resource that I recently found out about, a CRW, our building has an aphasia support group, and they meet weekly, I believe. So that'd be a contact with the rehab team to see how to get involved in that.
Excellent.
And then our last community question is, how long does it take to regain your energy and strength following B-cell lymphoma? And I'm going to add following any cancer, really. But, what does that recovery of energy and strength look like for people, maybe depending on their path into recovery and survivorship?
Yeah, that's a great question. And recovery really is very specific to each person. That's because everybody brings something different to the table, and everybody had different treatments, whether it's surgery, chemo, radiation, immunotherapy. It's a little hard to be very specific, but basically I'd say it's based on a person's individual body, what treatments they received, like I mentioned, and also their age. It's also based on how healthy a person was before treatment. Again, talking about, right, what did you bring to the table? I would also say on average, taking all these aspects into account, that it could take people as little, I'd say, as 2 months, depending on what type of treatment they had. Maybe we're talking about a younger person that just had surgery and they're good to go. Right, it can be very brief, maybe up to even a year to recover. And I know a year sounds like such a long time, and I don't mean to say that to dishearten or unmotivate anybody, but it can be done. You can do it. And I would say once your treatment is over, if you haven't already participated in our cancer rehab program or our cancer wellness program, please reach out. You can reach out to myself, to your physician, to your navigator, your social worker, because those will definitely get that recovery going. The beautiful thing about our cancer wellness program is that it literally prepares you to continue your healing and wellness journey beyond the program, right after the cancer wellness program is over. It gives you feedback on the improvements that you've made throughout the course of the program, so you can actually see your progress, which is very motivating. But it also gives you the tools to continue that wellness journey at home, within your community, at the wellness center. You receive a great list of resources to continue all of those things when you finish the cancer wellness program, things at the wellness center and things within the community, because we really want to be able to give you that the tools and the education and the motivation to continue that journey.
Yeah. And I think not to underestimate small progress too. I mean, you and I have been looking at the data from last year's cancer wellness group, and we had significant outcomes in grip strength and in endurance, and overall strength. And so maybe they haven't fully regained what they would consider their normal energy and strength, but in 4 months they've significantly improved, and you're going to feel that. And so, really being motivated by incremental changes.
Yeah. And I do want to hit home that point. We looked at statistics, and these things were statistically significant, the impact that the cancer wellness program had on people. So highly encourage and recommend our program, because it will make a difference.
Thank you so much for answering all those community questions. Is there anything you'd like people to know who are maybe brand new cancer survivors into the world, finishing up treatment? What's kind of your takeaway message for them, and do you have any resources?
Yeah. I would say to just keep in touch with your physician, right? It might be scary to realize that now that you're done with treatment, you only see them once every month, once every 3 months, but we are always here for you, whether that's your physician, your navigator, or even myself. Even if we've never met, feel free to reach out to us, because we want to make sure that you feel supported and have what you need to continue into your recovery and survivorship. And there are lots of resources out there for people to tap into, lots of mental health resources, which may be what you need at that point once you're into survivorship. So again, reach out to any of us because we certainly want to support you and make sure that you feel, that you're on your way on your wellness journey.
Great. All right. Well, Gianna, thank you so much for all of your knowledge and expertise today. And I'm looking forward to maybe another version of our interviews for more questions coming in.
I'd love that. I look forward to it.
All right. Bye.
Bye.